My name is Orii McDermott. I am a music therapist and I also work as a senior research fellow in School of Medicine, University of Nottingham. I started working as a music therapist in Central and Northwest London NHS Foundation Trust in 2001. 25 years on, I still hold a part-time post there, working in the older adults mental health services. I was happily a busy full-time clinician working with adults with psychosis and older adults with dementia for quite a number of years. So why did I decide to leave some of my really favorite clinical work behind and consider academic journey? First, I think realization that if we conduct clinically meaningful research, we can potentially help a larger number of people or have a greater impact on their care. While number of patients I can see or I can try to help as a clinician is limited by my daily timetable and also the system I work within. So really would definitely like to encourage fellow allied health professionals to consider research pathway because they can potentially make a bigger difference to our clients' lives. Second, clinically driven research agenda arose from my daily practice. My initial PhD proposal was driven by a frustration of the lack of a meaningful outcome measure for music therapy in dementia care. And that frustration got turned into a concrete research proposal, obviously with the help from my supervisors. But because I had in-depth clinical experiences working in multidisciplinary teams, and compared to my medical and nursing colleagues who often seem to have a problem-solving or symptom reduction focused approach, and obviously that's their job, so they have to do that. But I have become aware that allied health professionals often have a possibly more broader or perhaps more holistic approaches. So our kind of way of solving problems may not be the fastest, but I often think that we consider multiple layers of evidence and kind of value kind of individual choices or preferences of our clients. And that's, for me, that's really, really unique in kind of health research where typically randomized control trials are considered gold standard in health decision making. So in my experience, AHPs often prefer a mixed method approach and really knowing that qualitative data capturing their lived experience adds really meaningfulness and richness to more quantitative and, if you like, more objective scientific data. Often allied health clinicians don't seem to realize how much in-depth clinical knowledge they have and how they can contribute to wider research. Compared to some of my colleagues, so for example, clinical psychologists and medics who seem to think like research just as a part of their routine clinical practice, AHPs often seem to think research is reserved for only certain type of people, academic people, for example. And this is not really the case. If you have sufficient clinical experience, you can really contribute to research, and getting involved in research doesn't mean that you have to be doing a PhD, for example. There are so many different ways of getting involved in research and develop a clinical academic career. Appreciate that challenge of making our implicit, in-depth clinical knowledge more explicit and articulating in words. I serve as an associate editor for the Nordic Journal of Music Therapy, and we've just written a joint editorial on how to develop a perspectives on practice paper, really kind of hoping to encourage more clinicians to write and publish their work. I really hope that a larger number of allied health clinicians start considering research as a part of their career path and consider a clinical academic career path is a possibility. because of their holistic and in-depth knowledge of the client's needs and wishes.